I don't need a dentist. I've never needed a dentist. My teeth are in great health. Maybe you've said something similar along those lines. And one day you just decided to go see a dentist, and now you need 3 fillings, a crown, and you don't know what happened. It sounds very scammy, a little bit fishy, doesn't it? Well, today we'll be talking about the downward spiral in dentistry, how it can seem like one thing will just keep getting worse, getting worse, and getting worse until the very end. This is Hills Talk, and my name is Craig.
My name is Surprise.
Can you shut up?
Okay, there's a myth out there that there's a worm that takes over your tooth. In fact, in history, they used to think there was a worm in history, actually. But
Mm,
yeah,
I
funny.
do remember that.
Yeah, funny thing. But yeah, so people will say, if one tooth gets infected and the next one gets infected and the next one gets infected, is that the case? Are there worms in your teeth?
Not actual worms.
Yeah.
Yeah. Like the microorganisms, like really tiny creatures in there. And well, whether you have cavities or not, they're supposed to be in there.
Mm.
So
The fancy word for that is biome. So you've got like a lot of bacteria. Even in your stomach, you've got bacteria. Bacteria is everywhere.
on your skin,
Yeah, on your skin, on your head.
on your bed,
Oh,
on your
God.
pillow,
Oh,
it's everywhere. Oh, your steering wheel. Oh, it's even on your teaspoon.
yeah.
It's your favorite one.
Even on that love of yours.
It's a lot more there. And your dog,
Oh,
like everything, like microorganisms exist everywhere. So this is not just to get you paranoid, like, be a clean freak. No, we coexist with each other.
I used to watch Dr. Phil back in the days, and they used to have like this episode where they have like this clean freak, the OCD people.
Mhm.
And this guy would wash his hands and had a whole protocol. You don't have to do that.
No, you don't have to do
You
that.
don't have to do that. Even with your mouth, you don't have to do that.
Yeah.
There are bacteria in your mouth, but they're normal bacteria. And yes, the normal bacteria in your mouth do cause cavities, but it can be prevented, right?
Yeah. And my grandma used to tell me that there's a worm in her teeth, and even my older patients. So like they extracted a tooth, and then they would extract another tooth, and then they would extract another tooth, and I was like, yeah, the worm, just a worm is hopping,
Yeah.
right? But then there's that. It's not real. There's no worm. It's just a domino effect in a sense. Your problems don't really come in one go. They could be like you don't get one cavity and that's it, especially if you haven't seen a dentist in a long time. By the time you feel pain and there's just one tooth here that's bothering you, there could be, other teeth that have been affected. They just haven't reached your attention as yet. So no worm. It's just things that happen in your mouth.
And it can seem a bit funny that, you would have not gone to the dentist for 20, 30, 40 years and you get there and they just say, hey, this is what you need. And, or you get there, suddenly you do a filling and that filling turns into a root canal. It can seem like, oh, these guys are out here, corporate elites, trying to please their corporate elites. Is that the case?
No. But I've heard of those. The big pharma. It's for like these doctors just get trained to dish out pills and everything. Like no, not really. Like it's not like I saw this TikTok, where what's his name? This famous American professor in physics is like a physics influencer.
How Neil deGrasse Tyson?
Yeah.
Yeah.
I can't say it. He just said it. I can't. You could put it in front of me. I just my tongue struggles.
Just 2 years. Yeah.
Yeah.
Neil deGrasse.
Anyway, he was talking about like back in the day, like cavemen would live up to like 30. Most of like at least like half of the population would only get to like 30, and as we moved on and went to the Middle Ages as well, people would like make it to like 35. And these people were not eating GMOs. No, their food was 100% organic. You know, the deer was organic, the fruit. So it's not just a big pharma thing, because medicine is what makes us live now up to like 100. Not just like a small population of people, but there's like a huge um and growing number of like pensioners in some countries more than young people. There is increased longevity. So there's no conspiracy theory to kill or maim people with like what we do. It's just we're not there yet. We're not in the future where everything can just be perfect.
And you know, it's funny, right? If you look at the olden skulls, because I watch archaeology videos, okay, but these guys had like big jaws, right? Because they used to eat like seeds, like and hard foods, and like they have
Looks Mexican.
yeah, looks
Yeah.
they were
Lots
looks
of
like
chads.
but anyway, these guys are eating like seeds, meat, and I mean the thing that happened is there was a change in diet. I don't know, some time ago, and softer foods came and the jaws became smaller, hence the wisdom teeth don't fit over many, many years. And refined carbohydrates, which form part and parcel of our diet now. So that has led to like what do you call that? Cavities, you know? But interesting enough, they did have gum disease. Yeah, like I look at their skulls, I'm like,
Yeah.
I look at skulls. But I think I'll double check. But I think they had, because anyway,
They didn't floss.
they didn't floss.
No,
floss.
yeah.
I
So
think so. Anyway, but please, cause it was. But do you know what they did? They ate on like seeds, and then they like actually brushed like something like sugarcane, but not sugarcane like that. And then they'll chew on it, and then they'll just clean their teeth. So they did brush.
yeah, but they probably didn't do the subgingival brush
Oh,
and the base
modified
technique, but which is new. But anyway, you don't have to. We're not saying be a caveman or whatever. Just demonstrating that it's all a sequence.
Mhm.
It's not a mistake. It's not an accident. If you haven't seen a dentist in about 2 decades, don't be surprised if you have to do at least 3 fillings across your teeth, you know? And it's not the dentist who will weaken your teeth and then they break. It's just time, time catching up. The longer you have a cavity, the bigger it's gonna grow, and the more material we'll have to remove to fix the decay. Um, that and it's not perfect. Like we try and say we like I'm some material scientist are trying to improve composite, but basically getting the composite to match the tensile strength of a tooth isn't like 100% yet. So like that difference um can make your tooth a bit weaker. That's why we like cap the tooth after a root canal, you know? And basically, yeah.
Yeah, and it's so funny, right? They'll see this quote and you'll see thousands and thousands, and you'll be like, you know, is that Porsche yours? No, it's the patients across the road, guys. It's not our Porsche.
I don't have a Ford.
I don't have a Porsche, guys. Okay, I wish I had one. I wish. I wish. Anyway, but most of the money in dentistry goes to the materials and the overheads. It's pretty intense with the overheads and the materials. So, like the cost you're paying, and that's why we don't benefit by giving you work that's unnecessary. In most cases, most dentists give you what you actually need. So don't be shocked when you see a quote from a dentist. It's just material costs catching up with us as well, because we need to pay bills and things.
Yeah. And the hole does get bigger, but it's literal and financial. So you will get like a bigger hole on your tooth, and it's a bigger hole in your pocket as well. So it's always best to just try and prevent. Like I think for the most part, our most favorite type of dentistry is very minimal dentistry. So we give you like a cleaning, give you some fluoride, and you are on your merry way. We really love seeing patients like that. Like
Yeah.
if I see a patient today and I see 5 cavities, we patch them up, and then I have to see them again in like 6 months, in a year, in 2 years, and there's no gum disease, there's no cavities. We don't get sad because of that. We celebrate it, we
Happy.
encourage it.
Ooh, wow.
You know, when we see a patient and we give you the bill and you don't like, whoo, we get really happy. If you come here and you pay 650 for your entire treatment instead of 6,500 rand, that is a good day for us. Okay, so prevention is still the ultimate hero.
Perfection. And that's true. And that's why we always say, prevention is better than cure. And that's why we encourage patients to come every 6 months, attend to all that stuff, Yeah. And another one is, sometimes you do go to the dentist. Like you come here, you come frequently. And then one day, and it's so funny, this actually happened this morning. You have a big cavity and now you need a crown, a root canal. You're asking yourself, but what happened? What happened? What happened?
What happened? I was seeing a dentist every year, and you said I should see a dentist every year to prevent this. So it's called incipient caries. Like sometimes you just can't spot them. I can't spot them. The X-ray misses it. All right, it's right in between two tight teeth.
Yeah.
It's not visible, and like it's not like black and like a big hole. It like matches the color of your tooth, and you might feel some sensitivity. The dentist checks it out, can't see it, and a few years down the line, you're having like a sandwich, it breaks.
Mm, mm.
It happens.
It happens.
Yeah.
And it's not, oh man, I hate those. Like, and then you see it and then you're like, oh, let's just do a small filling.
Yeah.
And next thing, like 20 minutes later, like, wow. And then that awkward boy, but he just sits here.
So you remember when I said small filling?
Yeah.
Yeah, no. Yeah, like so the X-rays we use are two-dimensional. Like they only show you like certain aspects of it, of your tooth, and the depth is not always accurate. Or I might think like it's shallow from how it looks on the X-ray. And then once I put the drill in, he's expecting some resistance and boop, it just drops in there. Because like the whole thing is soft inside. Because well, it's been there for a long time. Either it was missed or you missed your dental appointments, and it might turn into a root canal. So it just went from 650 to 6,500.
Yeah. Oh, 10 times.
And that's just not it. Because you remember we mentioned how teeth get weaker, and now you need a crown. It's like 9 grand. Oh,
And you know what's so funny? You probably see us, you know, we have to do a root canal. And you're like, oh, wow, so grim, so much gravitas. But we feel awkward on the inside. I feel awkward sometimes. Like, oh, yeah, well, let's do a small filling. And then you're sitting there like, how am I going to word this? And then I walk to the reception and I say hi to Craig and I say hi to everyone. Like, oh, you again. Wow. Just procrastinating what's coming. The talk I'm about to have, it's gonna be heavy. Like, yeah, so
yeah. Especially if the opening line was like, I hate dentists. I don't want to be here. I don't even like. You make me anxious. And I'm like, good Lord, let me take a breath. I'll be right back. I'm gonna have to do some doctor stuff on the doctor computer, with the doctor keyboard. But just wait patiently.
my favorite is when I look at, give him my secrets. I look at the X-ray, zoom in, zoom out, change the contrast.
Trying to see like, is there another way around this? Can we avoid this expensive treatment? And like by the time we actually like present it to you, it's like the last thing on our mind. It's like the last option. It's by the time we say it out loud to you, yeah, you need an action. You need a root canal. Yeah, or to extract the tooth. But if you extract the tooth, you might need an implant. Basically, it just catches up to you.
Indeed. And you know what? Restorative dentistry, we call it restorative dentistry, where we fill your teeth and everything, is like what? what is it? It's like fixing something, like what? Like servicing your car, if I can put it like that. Um, if you take your car regularly to service, right? Provided it's reliable, I won't mention any unreliable brands. I'm looking at you, Land Rover. But anyway, sorry.
I thought you'd go for the Alpha.
Oh, Alpha. I've got beef. But anyway, if you service your car frequently, you will be able to keep your car. And one of the things that makes a car sell well is like a full service record. Why is that the case? Because you know that this car's been taken care of. Any small leak, any uh, oil leakage, any broken whatever has been sorted because all the problems pile up. And the same thing is in dentistry. Those small problems all pile up. You've got small cavity, it gets neglected, it grows, it becomes an abscess. That abscess becomes a endo lesion. Now you've got gum disease around that tooth. You've got gum disease. All these things just are a ripple effect. So yeah, is that correct?
That is absolutely correct. And I know we encourage fillings, and I'm not going to talk down on them. I think they're very important. Like if you come here, you have a little cavity, I will encourage you to get a filling. But remember, nothing in health, most things that are man-made do not last forever. Like, we spoke about those cars that we won't really bring up again, but there's a good old reliable, like Corolla maybe. Even those get tired. It doesn't last forever.
It doesn't.
So like even fillings don't. So a composite, I think in a video with this,
Yeah.
the previous video, we spoke about like how a composite filling will last you about 5 years. And it's a great thing if yours can like last a decade or even 2. But mostly they don't last that long. They'll begin to leak and everything. So like I call it a patchwork because we might have to redo it. And when we redo the filling, the cavity preparation is going to be a little bigger. And then another 5 years, it's going to have to be a little bigger. And eventually, well, that's a root canal.
Indeed.
And that's a crown. It's unavoidable. The one thing you can do is floss, use your mouthwash, come here, get some fluoride, strengthen those teeth, brush your teeth twice a day. No matter how wasted you are when you come back at night, listen, just do the shandies, do the thing.
And it's so funny. Coming to the dentist, there's a few cases where we do cleanings and stuff, and people still feel sensitivity. And they say, ever since I got a cleaning,
My teeth have been sensitive.
ever since I got it, and it's not the case. Like everything we do. And that's why we try tell you, but sometimes we don't. Remember, we sometimes have a busy schedule. We'll try give as much education, but yeah, and you go home and you have this big sensitivity, and you're like, wow, what happened? It's not. Those teeth are just exposed now. We could that whatever was causing the issues fixed now, and now that has led to this new thing you're facing, which is sensitivity or whatever it is.
Yeah, so you were just chilling at home, you're on TikTok, you fell in love with a face that you saw in the video, and you're like, nah, you know what? I'm gonna get my teeth done. I don't know why. I'm gonna go there and I'm gonna wash my teeth. And then you leave, and now your teeth hurt.
Can I say something? Yeah. I fell in love with somebody that I don't even know. I saw that.
I've seen that one too. I saw that one too. But like, listen, you come in there, she didn't hurt you. It's not her fault. Like, there's what we call plaque, which eventually turns into calculus or tartar. And it sticks onto your teeth. It holds on like a toxic X. And when we remove it, the damage that is done underneath your roots are exposed, your gum have receded. Now, when there's a breeze, it's gonna stimulate your tooth. When you're having like a cold beverage or a warm beverage, it's gonna stimulate your tooth. The dirt was just hiding the problem. All right, you had the problem all along. It wasn't built here. So like next time you wanna blame a dentist for your problems. Okay, now I'm getting
This is bullshit. No.
Yeah, I'm gonna call out every patient who said they hate me. What did I do to you? I'm trying to help.
Just a boy.
I'm just a boy, man. I'm just a kid.
But at the end of the day, that's why prevention, and that's why coming regularly. And that's why, look, if you don't have the funds, because dentists can be expensive, but BTW, there are dentists in every region with different prices. There are dentists in the bougie markets, and there's dentists in the, you could like low LSM regions. And if you've got no money at all, there's dental schools as well. And so there's a lot of options you can explore. And also there's something called the pillow pepper trade if you're far away. And it comes to many regions. And it, so there are efforts by government and, there are efforts by practitioners who see a gap. So really, we are trying to meet you. So you can just put in a bit of effort and you will save yourself a lot of costs.
Yeah. And in closing, I'll leave you with a philosophy. Might or might not be accurate, but I think it is. But like maybe someone else in a different field will beg to differ. I think dentistry is one of those, or maybe the only medical field where you are punished for the longer you wait. So say you don't see a GP or a dietitian for like 15 years and you gain a little bit of weight and you get like you're pre-diabetic and you get high blood pressure, we can give you some pill, uh prescribe a new diet, a workout routine, and you will go back to optimal health. However, teeth hardly regenerate. They don't regenerate, not hardly. Your bone doesn't regenerate like that. And so when you do lose a lot of bone, you'll have to get surgery to restore it, or you need a crown or an implant to do that. And it costs almost cost.
Yes.
It costs a shit ton.
Yeah.
Okay. So there will be some punishment. The one way you can keep everything as affordable as possible. Don't wait for pain. A little mild discomfort. You have just like you can come in. I'm like, oh, it's nothing. I'll just apply a little desensitizing agent. No one will punish you for panicking and trying to attend to your health, but you will be punished by the field, not me. I won't punish you, just biology. If you wait too long until you feel pain, by the time you feel excruciating amounts of pain in your mouth, it's kind of already too late. You are gonna like lose a tooth or pay a lot and also experience the trauma of just the dentist trying to pull. Like, I don't know what it looks like. I know what it looks like. Someone has pulled out my tooth, but like just that. And you see the sweat and you see the expression of violence in your dentist's face trying to pull out a tooth. Even if it's like free, you go to Palo Pepper, you go to Medusa, that is a traumatic experience. Someone you're awake for it.
Yeah.
Okay.
Yeah.
That is a lot.
I had wisdoms taken out. I wasn't.
And you were awake for it.
I was awake. It was a sensation. It was a sensation. It
Yeah.
was. It was. It was.
Like I took out my tooth because I was too traumatized about having a person in front of me. So I just like, I'm just
Yeah. No, it's something. But shout out to Dr. James Mchenga. We love you. I love you. He did it. Oh yeah, he did it. Yeah, but
cool dude. I forgot him.
yeah, he took out all four on the chair. And I was like, ooh.
I say cool dude now. He almost made me feel enforced. Like he said difficult questions.
Yes, he did. He did. But he did say like, I expect you in class on Monday. I was like, whoa.
Oh yeah.
Chill. Anyway, but nonetheless, it's true. Teeth, unless you're a crocodile or something, you're never getting another set of teeth, okay?
Was it crocodiles or sharks?
Sharks, yeah. Yeah, sharks. And
that would be nice.
yeah. But until we have growing teeth again technology, you gotta take care of these bad boys. They're the only set you have. And once they're gone for good. And the replacement options, like we said, previously mentioned, are not as good as Mother Nature. So the longer you wait, the more problems you accumulate. So make sure you see a dentist when it's still light, when it's still early, and make sure you come up with a plan that works for you if you have problems at your dentist. Because most dentists are cool. You say, I can't afford it this year. It's fine. We'll do something until you can afford it next year. I get we're not trying to please our corporate elites,
No. Yeah. Oh, did you see the Chinese are generating teeth?
Yes, I saw that.
Yeah, we're not there yet, but like they might be able to grow out your teeth again.
One day.
Might be really, really expensive as well. We don't know. But one day they will be able to generate teeth. So we recorded this in the 30th of July, 2025. So if it ever goes viral in 2045 and they were like, "Huh, those idiots didn't know." Like, no, we knew. We're just not there yet.
Yeah, let the end.
Hmm.
Anyway, how do we close this off?
Tom's wearing a nice shirt. Do you guys want to see Tom?
I'll just show you like a pattern of the shirt. This is it.
You should show up in the video one day so they see the.
I think they've seen Tom before.
Well, they've seen Tom?
Yeah, they've seen Tom.
Oh, okay.
Yeah, mother's
Maybe they were not sure.
Oh, yeah.
Tom is the handsome fella with the beard. Yeah, who said something about his. Just look, Yeah, he's married.
He is?
Yeah, he is.
Oh, okay. Congratulations, Tom. Cool. Well, book your appointment and then we'll check out your teeth and try to keep everything snazzy.
Fantastic.